Good evening. My name is Boniface Miriko, and today we want to speak about something very important, something very passionate that many Kenyans are going through. And this is something that every household need to hear. And this is a great discussion that today I'm joined with great panelists here, and I'm going to let them introduce themselves from the lady near to me.
Hi, hello. My name is Shalin Mumbwa. I am absolutely honored to be in this space and contribute towards this discussion.
Thank you, Shalin.
Yes, hi everyone. My name is Austin Oduor from Maternal Newborn Health, so Health CEO, and I'm honored to be here today to share my input on the today's discussion.
Yeah. So today's discussion is about SHIF, SHA, and all that, because Kenyans want to understand what are we presenting, what is the government presenting to the people, because we've heard of SHIF, we've heard of SHA, we've heard of NHIF. So in a nutshell, let us start with there. Austin, maybe. Let us start with you. Kindly explain to us what is SHIF, what is SHA.
Yeah, the discussion has taken back to an ECD school where if you go to the street, some say about she, sha, she, shu.
Yes.
But it's only the two she's.
Yes.
It's SHA and SHIF.
Yeah.
So this is a health authority, where SHA is Social Health Authority.
Yes.
And it's a government initiative to do away with the former NHIF, which currently we now say former.
Yeah.
So it's the government wants every Kenyan citizen who is 18 years and above to register with SHA.
Yeah.
Then after registration with the SHA, now each and every individual will be able to access the health services in a level 2 facility and a level 3 facility for free.
Okay.
Now we come to the second part, which is now SHIF, Social Health Insurance Fund. This Social Health Insurance Fund, the public, some of them are registering through dialing *147#. Others you go to the CHPs. Others are going to the cyber cafe. Currently, I read the local newspaper today. The cyber cafes are booming. They are getting business on that. Others, you can even go to the facilities that has the SHA offices or the Huduma Center. So from there, your information data will be captured, and based on your level of income, you will be assigned a certain amount of money that you're supposed to pay. Initially, like I saw another grandmother is paying 50 bob per month, which is accumulated to 600 per year. Yes, the others paying as little as 138, which is around 1,630 something shillings per year. So it depends with the information you give, and the government is appealing for honesty on that information. So the information you give will lead you to how much you are supposed to pay per month, and it leads to per year. So it's then now the people employed, even this point is supposed to accumulate 2.75 of your total income. That's what you're supposed to give out, and that's now it will roll out into the facilities, I think.
That is a very good nutshell of what SHIF and SHA represent. But Shalin, I'm coming to you right now. We've had very many questions out there regarding this issue. What have you heard maybe on the ground? What are people asking about this?
First of all, the first question was, why would we need to boot NHIF, which is actually gathering momentum in the proper service delivery in our country, and instead of us actually creating an entire new forum and an entire new initiative, inheriting their debt, whereby, and incurring some more, because I believe we are aware about the 104 billion tender that SHA will be incurring in about the digital superhighway, am I correct? Yeah, and so that was the first question. Why did we need to boot NHIF? We could have used all that money to actually make it better. The question actually now that was quite appalling was, why are we having children who are 18 register as separate households? When we look at the average phases in our country, an 18-year-old from 4 leaver. CBC, is that a grade 12 lever?
Somewhere about that.
And so in actuality, they're not employed, right? They're actually very dependent on their parents. So why, which is basically saying the parents are going to actually incur twice the amount of money they're paying for insurance, yet they could actually make the work easier by having the kids as dependents, but until a very sufficient age, perhaps 21. Because it was very not strategic to have 18-year-olds register as separate households. And currently the other issue would be, why would they actually enact it when now we have people with chronic illnesses having to incur out-of-pocket expenses when it comes now to dealing with their healthcare? And so those are the main issues I actually had on the ground, and I think they are very good questions to answer.
And that brings up the question of how was the transition done? Because we had an issue with the transition, and I'm coming back to you now, Austin. There was an issue with the transition where we were transitioning from NHIF to now SHA. And in between, a lot of people went to hospital because people don't stop becoming sick because you're transitioning. People went to hospital and they were stranded. We have actually lost a few people because of that. How are they working around this?
Yeah, that's a good question. You realize sometimes if you walk around the streets of Nairobi or part of the country, there are two entities if you named in the community and just say like, I want you to give me one word. So say this, you just walk in the streets of Kenya, talk about, I want you to give you one word about KEMSA. People talk about that's hotbed of corruption.
Yes.
The same during NHIF. When I just want you to write one sentence about NHIF. It's payment, no services. So NHIF had a lot of baggage on it. It reached a time that, let me say this, so ushajichafua mpaka hata uweke which detergent, it can't come clean. Yes, my sister was talking about that. We can revamp NHIF, we can do another. Ile ilijichafua that hata uweke which kind of detergent, it can't go back to original. So the way was that we have to come back to a new entity. By bad luck, the new entity during that transition, remember even during the county government, others coming from municipality to county government, there are billionaires who made money during that transition. Because there's a lot of confusion, who owns what. So during that, in fact, currently the SHA CEO is on leave, on a leave now because of some issues. So during that time, there was NHIF had a lot of issues that cannot be sanitized. Let me use the word sanitized. It cannot be sanitized. So during this now, the new transition, there's people who take advantage of every opportunity. Because again, another thing, I also default government a little bit. There's a lot of information that the common Mwananchi do not know about SHA. And SHA also keeps on changing. They keeps on updating new updates every day. And even the bigger part of the health providers. Sometimes you go to the facility and ask them, they are as green as you. Some of them are green as you. So that's some of the faults that are there about SHA and SHIF. The information is not clean to put. That's why if you walk in the country today, ask people, they will not give you a proper information. You'll get different information that is passed across the community.
Maybe I'll take something from you and pass it to Shirley. Because you've mentioned about NHIF and losses. Now we are transitioning to a new kind of a framework. What happens? Because there are questions, as she said. People were asking about the NHIF being corrupt. So what happens with NHIF? Because now we are transitioning to a new system. Do we forget what happened with NHIF? Do we forget people who benefited from the money that people contributed to the NHIF?
I think that's now the cases that are there should be with the ESCC. The good thing with the Kenyan, we keep on forget very fast. So whether the cases are still on, so we rely on media to come and update us. But I think that's now lies squarely with the authorities, the ESCC, the courts to expedite that. But they will go, some of them will come, will see the light of the day. Some, but we are not supposed to forget because that's public money. The authorities should act, and if there's anybody who was found capable of anything, his assets should be recovered and the funds should be taken back to SHA now. But there's a lot of cases, which means the authorities, most of the ESCC, the courts, they should not drag so much because Kenya we have a problem of we forget very fast. So we don't need to forget.
So back to you, Shirley. The question of public participation in all this, where does it lie if we're speaking about people out there who want to be involved in this? Was it done, or how are people responding to all this?
Well, in regards to the public outcry that came in with the SHA and SHIF enrollment, public participation wasn't efficient because I think we have to bear in mind these initiatives you're setting up meant to actually help the civilians, right? And so with public participation, we are able to now talk to the civilians, know what are their needs, what should we prioritize, so that the policies can align with that. So I think the problem that came in with the SHIF and SHA, the civilians saying most of our needs are not being met, and of course this can be attained because we don't have sufficient data. If you're not talking to me to know what's actually harming me, how you're going to help me, and yet you're supposed to actually maneuver my aid, right? So I think public participation was at an all-time low, and it should be done again so that they can actually now have accurate data and understand where are the areas that we need to prioritize on, and to have to ease the service delivery.
So you believe public participation was at the center of rolling out the SHA initiative by the government?
Absolutely.
Yeah.
I do.
Bonnie, I wanted to add something on public participation.
Yeah.
We as civil society, we still have a lot to do on public participation. One, there is the law that governs the public participation. It's not, first, the threshold.
Yeah.
We can take in a constituency which have, for example, Starehe constituency in Nairobi. The last previous election had over 160,000 registered voters. You take 20 people in Kariakoo Social Hall, then you say that's a public participation. Just ticking the boxes. A law has to be put in what first is the threshold of a public participation. Who are supposed to attend public participation? Because a politician or anybody or any decision maker can pick his cronies, put in a social or put in bombers. Then they tick the box. The public photos are taken.
Absolutely.
That's it. So, in fact, I blame the National Assembly. This law, it's lying in Parliament. Is not yet made. Actually, like we need a proper public participation, well structured. The one that is on SHA. That's why people are claiming that we don't understand SHA, because there was no proper public participation. Because a public participation comes, they take some small people in a corner, put them there. And some of them even, like, they don't even represent 0.1% of that ward or even of that constituency.
Yes.
So even they say that they will going to spread that information into the community. The information is going to reach as it's supposed to be. So first, in terms of public participation, we first have to enact the law properly. Before now we say that a public participation was properly done. Yes.
So the policies behind public participation in Kenya are a bit lax.
There's a lot of gaps.
Because I attended one public participation, for context, in Machakos just this year, and it was just a formality. They come, they announce what they are doing, and they leave. You are not participating per se. You are just there to stamp.
Yeah, like,
and that is the problem that we have.
Like when I share, just give me 1 second. For example, I attended a public participation somewhere. I don't want to name the place. Where there's a CIDP.
Yes.
It was of close to 300 pages book. People are given this book at 11 p.m. a.m. Sorry, 11 a.m. and the activity is supposed to end at 1. So you're given over 150 pages book to read in 2 hours. Understand it and make your views.
It is impossible.
For heaven's sake. Even if you're a professor, it's not possible. So first supposed to set a date. The public is given these books on time. They go through them. Then a day is set. So they internalize the documents. And now it's not like you are given a document today. Go through it. Within next 20 minutes, we are starting. We need your views. We need you to react. Then after 1 or 2 hours, the public says, okay, you have signed the form, the tick box. Photos have been taken, my name have been captured, I attended. And but it's not based on like I attended. Did I understand what I attended? What was my views?
Yes.
Those are some of the questions that.
And then they tell you, write. If you have anything else, write to us. So let's segue to the matter of this SHA and the implementation of it, because it is a very good framework, and we are a country of very good policies. We know that we have very good policies, but when it comes to implementation, that is where it hits us. Because if you look at SHA, as you explained, Austin, we have different tiers. We have from the accident, and then we have primary health care, which people are not actually contributing. It is the government that will contribute from its own budget. Now, Charlene, this year, we've had the Gen Z coming out saying that the taxes are too high. We are not going to bear more taxes. Now we are going to have a system that will warrant us to actually pay more taxes so that we can be able to finance this kind of a system. What is your perspective on this?
First of all, I think the greatest issue when it comes to taxation is when you're taxing me, but then the services that I'm actually getting, they're not worth I'm not getting value for money, rather. Understand? So the first question is, okay, so we're talking about SHA is going to facilitate free healthcare in level 2 and level 3 facilities, correct? So how unfortunate is it to actually have civilians pay for that money and then get to these facilities and then they get a dispensary standard of healthcare? Is that fortunate?
Yeah.
There's no equitability in the taxation. So personally, as a Kenyan, I have no problem paying for the taxes as long as there's the efficiency of the healthcare that I'm receiving, and that the healthcare is also, should I say, of proper standard. Absolutely, that is actually the word.
Yeah.
That also enables the UHC that is actually now on a global platform, correct? Yes, that's my take.
Yeah. Also on mine one, I will fault the whole SHA community, the whole SHA on issues about how this thing was hurriedly done.
Yes.
As we speak now, people are being taxed.
Yeah.
For example, the employed are income of 2.75. A Kenyan payslip now, it has a lot of holes.
Yes.
It is overtaxed.
Yeah.
If a Kenyan today can hear again this, and then the taxes comes if I am taxed, today I'm taxed 2.75 on my pay.
Yeah.
If I go to my facility for an outpatient, like the other day I was in my facility for an outpatient, I was told that I cannot access the services. The SHA have not enrolled outpatient services. They are still only reimbursing the inpatient services. And the SHA has been in existence. This is now the 3rd month.
Yeah.
So if 60 days, they have not, do you think people are not getting sick to need the outpatient services? So this thing was hurriedly done, but they didn't do, okay, they do hurried to tax the Kenyan people. But now the services is a gap. As we speak now, a big number of people are not getting outpatient services. And even those getting the inpatient services, there's a lot of gaps there that taxation is done.
Yeah.
They are collecting the money. But now, is the money matching the services they are offering?
Absolutely.
That is the big question. They hurried it very much. I think the president and the team could have given it time.
Maybe
So
a
that
pilot.
maybe they could have done a pilot with specific facilities, like maybe level 6 facilities first, watch it for maybe 3 to 6 months, then now is when they roll it down to other facilities, because a number of Kenyans are really suffering in level 4 facilities and level 5 facilities as we speak today. It's not like there's few who can speak for them, but there's a lot of suffering. The implementation is hurried so much that through the process, you are having a process, there's a lot of casualties. If you go to the facilities today, people who are getting discharged are crying. There's a lot of us, as I speak there, I'm around in 7 WhatsApp group for medical bills. There's a lot of WhatsApp groups that people are now collecting funds to pay for the patients.
So that's the situation on the ground. And let's now talk about the kind of criteria they are using to look into whether someone can afford this SHA. They call it the means testing tool, so that if you are not employed, you are asked a few questions, then they gather the information that you are eligible to pay a certain amount. Is it really working? Is it something that is feasible, Shirley?
Well, I remember the SHA CEO, when SHA and SHIF was being enrolled in October, he stated that the means testing accuracy was low, right? So how can you actually trust something that already the facilitators can state it's low in accuracy, but we're about to use it, it's hilarious. So I think there are better ways we can actually use to collect data. I mean, we live in the 21st century. Technology can be used. We can leverage technology. And when they talk about the means testing, it's I think one of the characteristics was checking your household and you know how many rooms you have in your house, etc. That's very. I mean, is there a privacy breach with that? But I don't think it's efficient, because actually it creates a great loophole. You can lie right through your teeth, right? And it's not really. And
someone also said that, you know, you can have your mom at home and you can build a house for your mom and everything, but maybe she's not employed. And then when they come to evaluate her, they'll see as if she's earning a lot of money, then they put a higher threshold on her to pay. Austin, what is your take on this?
Bonnie, on that. We have people, sometimes you may be employed some 5 years ago. During employment, you worked so hard, built a house, permanent house, bought property that had quality that will serve you for maybe 10 to 20 years. So SHA is putting, like, they come to my house, say, what's the wall I'm using? What's water I'm using? Which electronics do I have? Sometimes these things I did them 5 years ago when I was on employment. Today, maybe I am not in employment. So if you use the things I did 10 years ago as a determiner of my income today, you are using a wrong data.
Yes.
Those some of the things.
Yes.
Like if just say, Bonnie, sometimes I built my mom a house, or sometimes it was built by a well-wisher.
Yes.
There's a number of people, like where I come from. There's this Obama Foundation called Give Direct.
Yes.
They built a lot of houses in Nyanza and western part of the country, and some even added some small money. So if you use a house that was built by a Give Direct as to equate the income of that person, that is very, very wrong.
Yeah.
So I also saw a circular something that the KRA is planning maybe to check on people's M-Pesa, so to authenticate your level of income.
Yeah.
I'll give you a good example. We have the people doing Mjengo.
Yes.
I do Mjengo along Kangundo Road. I'm the foreman. We have 30 workers. So we have worked from Monday to Friday. After the end of the day, the owner of the property sends payment for 1 week for 30 people. He cannot send to each one of us.
Yeah.
He will send to the foreman.
Yes.
So each of the staff or each of the Mjengo guys is supposed to get maybe even 10,000 each. So I have 30 people. He's going to send for me around 500,000 Kenya shillings in my M-Pesa.
Yes.
Out of this, you find that my share here is 20,000. I'm going to get this money and pay out to the people. So if Kare comes and checks, Austin, you have transacted this month 1 million.
You are a rich man.
But in real sense, my money here is 20,000. So that's a way that sometimes you will take people to prison or you will incriminate people wrongly. So M-Pesa, some people are just used as a conveyor belt. In there, some people like in Kenya, the Kenya today is we are living on something called Fuliza generation.
Yes.
Charlene here is my friend.
Yeah.
Bonnie want to send me 500. Bonnie usinitumie, niko na Fuliza. Send to Charlene
Direct.
because she don't have Fuliza.
Yes.
Now she withdraws and give me the cash.
Yeah.
So you know that money will be recorded into as Charlene's income, but it's not her income. I've just used her as a conveyor belt for the money. So that thing, it cannot work. They need just to come up with how to evaluate people's income in a better way. Because if you use some of those properties were bought long, some people's M-Pesa or bank transaction as used as conveyor belt. They don't even own that. I've seen a treasurer which is given a loan to go and withdraw because one of the loanees do not have a bank account. So since the treasurer has a bank account, she was given a check of 200,000 and the loanee accepted to give her a fare of 1,000. So she went and withdrew 200,000 and gave the loanee 199. So if KRA comes to the treasurer that you have transacted 200,000 and in real sense she has just been used as a bridge for that money. So I don't think that can work very well.
Yeah. And speaking of the Fuliza generation, we know the situation of the economy of this country. And we understand where we are. We are in the rocks. We cannot be shy to say that. Do you think this initiative came at the right time for this country, Shirley?
Absolutely not. Absolutely not. Because actually, as it is, the initiative is now recurring debt now, because now people have to get taxed now to actually support the initiative. So you can see the efforts of the government trying to pull in the resources from the employed people, the low and middle income earners. So most definitely, and at a time where taxation is at an all-time high, we are going through inflation. So I don't think it was a sufficient time to actually enroll it, and therefore they could have actually, like Austin said, they could have actually carried out an experiment to see how effective it would be at an economic time like this. Because currently it's just causing more financial strains on already suffering citizens, which is very unnecessary.
In the medical sector, maybe.
As we speak now, we're living on a Fuliza limit. When I go to facilities,
yes.
naurumia wa mama sana. And people, you know, health is mostly for children and women. Men, for us to go to a facility, you are bedridden. We rarely go for checkups. Sisi tunakaa ngumu. SHA, currently, for example, let me talk of maternal. When a mother has delivered, normal delivery, SHA is paying 10,000 on a level 5, level 4 facility. A mother comes from an informal settlement, do not have an income, a mother, the SHA will pay 10. But before SHA pays 10, SHA is forcing this mother to pay for 1 full year premium. The person you are forcing, sometimes you have been registered, you say that you're supposed to pay, for example, maybe 5,000 shillings. You will force to pay 500 shillings times 12, 1 full year. And the person you are speaking today do not have that income. They will end up Fuliza. For CS delivery, SHA is paying 20,000 shillings. Majority of the CS, the bills go beyond 20,000 because they spend close to 1 week in facility. I've seen a number of them, their bills goes up to 35,000 shillings. Then SHA tells you, I'm only going to own 20,000. The remaining 15,000, look on how you're going to pay. There's the facility pay bill. People are really suffering.
Yeah.
Initially, we had Linda Mama. It was the best. Because that, like in Nairobi County, mortality rate reduced.
Yeah.
And delivering at the facilities in Nairobi was around 99%. We only had issues in areas around the northeastern part where the facilities were long distance. So today, a big number of people are not going to deliver. This SHA is going to reduce, to take us back into mortality rate, where some people will fear going to facility because, one, they don't have money to pay for the deliveries. Two, she talked about young people. Do you know what, Bonnie?
Yeah.
Teenagers. If you are now less than 18 years and you happen to be pregnant, you are supposed to deliver. SHA will not cover. Your mom's SHA will not cover. Your mom's SHA only cover the medical bill, but not maternity bill. You will pay, even if the bill is 100,000, the family will have to pay 100,000. Do you know the repercussion of that? That's going to increase abortion.
Yeah.
That's going to increase a lot of home deliveries. Because they know if I go to facility, a big number of us will not go to the, SHA is not going to pay. Like initially we had Linda Mama. So the young girls, they will end up doing abortions. They will end up delivering at home. I know they are still young, they are less than 18. They will end up, that will increase the mortality rate. So we are walking in a very dangerous path with SHA. I just think that the president can relook this. And we take a step back and evaluate. Because going forward, I don't know.
Well, this discussion is very, very thick. I think we'll have another session to discuss all this. Maybe just let's have final words on what you think now, because you've said a lot of what SHA is not delivering. Let us say maybe what do you propose is the best option moving forward from this particular initiative that the government has.
I would actually start with saying advocacy. Advocacy. And I think it's safe to actually let people know what advocacy is. Advocacy is not that loud voice in the wilderness that says reject and inject. Advocacy is all about an informed opinion. And so in regards to SHIF and SHA, the citizenry has its duty to learn about its patient rights, right? Understand yourself, understand what is owed by you, by the health providers, right? And also engage the policy makers, sit them down, make them understand this is where the disparities are at, and this is where we need help. You cannot actually come into our area and prioritize tertiary care, and we are actually desperate for primary care, right? You cannot come here and actually prioritize is it called preventive healthcare? You cannot actually prioritize preventive healthcare, and yet the maternal sector is actually sinking, correct? So it's about advocacy and engaging the policymakers so that we can have a symbiotic relationship between the government and the people, where needs are being met through accuracy. You cannot come and actually treat a cut that is non-existent on my hand, right? You have to go right where the problem is. Otherwise, there's so much, and to have transparency and accountability, because these things play so much. I think citizens need to see a draft of the budgets that you're actually putting into their healthcare, and to see the draft of the policies as well, to see if they agree with it, because there's also the issue of people resisting the policies you're creating for them, correct? So that's my take on it.
Yes, my take is it will go direct to the president, because he's our CEO. The way it's called swallow the bitter pie, the way he did away with Adani. People applauded him. Sometimes, as a CEO, you make trials of programs or everything. So I will also blame the people that are advising the president. They are not giving him the right information from the ground. From my general opinion, people are against SHA. They are totally against SHA. People have been forced to join SHA by force because they don't have alternative, but they are against. He can just suspend SHA, listens to the people's view, come up with a people health care covering, not some small quota. It may be good, but the people were not brought on board from the onset. Their input was not there. So this issue about bringing Adani on board.
Yeah.
Then some money has been paid, the pen has been put, or ink has been put on a paper. Means there's things, even as the CS is saying, we are not going to pay. I know they will pay, chini ya maji, they will pay some, because those are agreements that has been made.
Yeah.
Again, SHA imekuja 3 months they have served, they have signed contract. Again, if you stop it. So this issue about every time the government is bringing new things into people, again, they are stopping halfway.
Yeah.
We are making gains 1 step ahead, then 2 steps backward. Any new project or any new initiative, the government should bring people at first, get public participation, involve people, inform people, hear from what the people are saying. Because as I speak now, people do not. So the advice to the president, just like, make sure, just suspend it a little bit. Come up with a transition, something that can work between maybe 6 months. Inform the people about this SHA or anything. I know, and it keeps on changing. There's a new one during the presidential this called speech at the parliament. He came with a new word, Taifa
Care.
Taifa Care. So people are still grappling to know the SHA. Now again it has moved to Taifa. So in the next year presidential, again it will be again another name. So that's something that the president should work on, like make sure that he listens to people. He suspended this for the time being, so that people understand and come up with something new that people understand and they are involved from the onset.
Yes.
That one, it will not bring us where we are now. Thank you.
Thank you. And just to finish up, I think it is very important to make sure that even that grandmother at home understands what SHIF and SHA is. Because if only it is about us, then we are not hitting the goal where it's supposed to be. That is the conversation today.